I'll be assessing the cranial nerves today. Cranial nerve 1 is the olfactory, which is sense of smell, which we will not be testing for the purpose of this exam. We will move on to testing cranial nerve 2, which is the optic nerve, field of vision. I will be performing the static wiggle exam, and I'll ask my patient to identify when my fingers reach her field of vision.
Now. Now.
What I was assessing for is that my fingers reached her field of vision at the same time they reached mine, which is the appropriate finding for this test. I will then be moving on to assessing cranial nerves 3, 4, and 6 together. The ocular, motor, trochlear, and abducens. These are responsible for eye movement, so I will be going through these 6 conjugate fields of vision. I'll be asking my patient to follow my finger. I am assessing for conjugate gaze, and I will assess for convergence. And she had no nystagmus and no ptosis. I will then be moving on to assessing cranial nerve 5, which is the trigeminal nerve, and this is responsible for the innervation of both the temporal and masseter muscles. So I will be testing her drawstring. If you can clench your jaw for me, open your jaw, and move your muscles side to side. Great. And she has symmetrical and strong movement. I will then be assessing the sensation of the structures that this cranial nerve innervates. I will ask my patient to close her eyes and identify if she is feeling either a sharp or dull sensation.
Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, so she was able to both correctly identify the sensation, and that was symmetrical. I will also be asking her to identify when she can feel light touch, so I'll have her close her eyes and identify when she can feel the cotton ball.
No. Sorry. No. 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 No.
Okay. And this is also the appropriate finding. She was able to identify when the cotton touched her face, and that was also symmetrical. At this time, we could perform the corneal reflex. I would take the wisp of cotton and touch the corner of her eye, and I would be expecting her to blink or have tears. I will then move on to cranial nerve 7, which is our facial. So I will have my patient show her teeth. I will have her close her eyes so tight that I cannot open them. Great. I'll have her scrunch her forehead. I will have her puff out her cheeks. And I will have her shrug her neck muscles. Okay. And all of that is the appropriate finding. She was able to perform each of those exams symmetrically and strongly. I will then move on to cranial nerve 8, which is acoustic. So I will stand behind her about arm's length, and I'm going to be performing the whisper test. If you can cover one ear.
9x1. 9x1.
And she passed the whisper test. If she didn't, and we were concerned for hearing loss, we would assess whether it was conductive or sensorineural neural, and I could perform the Rene or the Weber at this time. I'll now move on to cranial nerve 9 and 10, which is the glossopharyngeal and vagus. So I will have her say "ah." I will be, so what I'm assessing here is the soft palate, larynx, and pharynx. So one more time, I'll have you say "ah." So what I am assessing is that the soft palate moves symmetrically, the uvula remains midline, and the posterior palate moves medially, which was correct. I'll then move on to cranial nerve 11, which is the spinal. So I will have her flex we'll be assessing the trapezius muscle, so if you can flex against my hands here, push against my hands, that's great. And then I will have her move, push against my hand here as well, and here as well. And finally, the last portion of our exam is cranial nerve 12, which is the hypoglossal. So I will once again be assessing, I will be assessing her tongue. So I will have her open her mouth one more time. This time I'll have just her tongue, I'll assess her tongue just as it sits in her mouth. Another part of this exam would be assessing her speech, making sure that her speech is articulate. I will have her stick out her tongue and move tongue side to side, which she has performed symmetrically with no abnormal findings. And that concludes the exam.